The great privilege of working with Dale and Lauren in my capacity professionally as a management consultant, but I also have cancer, and I'm someone who uses exercise very extensively throughout my cancer journey, and so I want to talk to you guys a little bit about that. And one of the things that resonated when Dale asked me to speak was about this idea of determination with exercise through cancer treatment. So I want to talk a little bit about that as well. Many people meet me and say, how could you possibly have cancer? You don't look like you have cancer, which is true, I guess. But then when I go on to say, not only do I have cancer, but it's a bowel cancer and it's a stage 4 bowel cancer, that usually comes as quite a shock to people. It certainly came as a shock to me. So I was diagnosed 4 years ago with the stage 4 bowel cancer. It had progressed so extensively through my body. I had a liver that was riddled with tumours and was, at the point of my diagnosis, completely inoperable. So I was unfortunately told that I was going to be facing a palliative treatment and that this would be the end for me, but we would try to keep me going as long as possible. I had a pretty vested interest in keeping going because I was 32 years old at the point of my diagnosis, and I just had a baby and he was 8 months old, so wanted to live. So I got a second opinion who prescribed me a really harsh chemotherapy regime and also prescribed exercise. This was something that I was very curious about because I have always been, post high school, when I always forgot my sports uniform, but since then have always been a fairly active person. I was all through my pregnancy, I was in the gym, I was exercising on my due date in the gym, I was all about it. But exercise and cancer together was something I was really curious about. I wanted to understand the evidence base, so I really dove into it, and then as a result became a little bit of an advocate for exercise medicine. So I used it, and I used exercise as part of my chemotherapy regime, and we basically had the task of taking me from a slowly dying cancer patient to a potentially resectable cancer patient. So we wanted to get me to the stage of being able to operate on my liver and to take a lot of that nasty cancer out, and send me on a path towards cure. So I used exercise as part of my treatment, and the way that I thought about it internally was that this was something that I had to own as my contribution to my treatment. And so every fortnight when I would go in to meet my oncologist, we'd sit down and he'd say, okay, well, this is the results, these are your bloods, this is the result of your latest scan, and I'm sure a lot of people in the room will be familiar with these conversations. And then I would say, okay, well, this is what I've done in exercise, and this is how much I was able to bench press this week, and it was a PB, and now I'm running 5Ks instead of 4Ks, and that would be our dynamic. And after 12 rounds of chemo, lo and behold, we got to an operation. And I got to have that impossible surgery that I was told that I was never going to have. And since then, I've had another 10 surgeries on top of that first one that I had. So it's really become a bit of a marathon, for lack of another word, and why not use a physical sport-based analogy, to keep me alive. And so we do a little bit of treatment, and then we do some surgery, and then I've transitioned to the point of maintenance therapy 3 times now. I'm currently in a technical remission. There's no evidence of disease in my body. I've got an MRI tomorrow morning, so hopefully that'll go well. And that's just, I guess, for many people in this room, will share that kind of understanding of what it is to kind of be in treatment and to have to do it for a really extended period of time. But the other thing I just wanted to touch on in terms of determination and using exercise as a medicine, because it's something that I feel like I've done very effectively. One of the things that I found more difficult to do is get a relationship with exercise that is mindful and is restful and is releasing in terms of my mental state sometimes, because I see it as something that I have to do, and it's really hard work, and I'm in there and I'm fighting and I'm focused and I'm working. And sometimes you don't want that from exercise. Sometimes you just want to go out and just release. Sometimes you want to do a Pilates class. Sometimes you want to go for a walk. And I find it very hard to do that component of exercise. So that's an ongoing journey for me, to find the relationship with exercise that is something that is a medicine for cancer and something that can be used so effectively. And it certainly has been. And I could obviously speak for a very long time about how successful exercise has been for me, and I'm happy to take any questions if there's time. But in terms of managing side effects from peripheral neuropathy to fatigue and nausea and everything else, but it's that using exercise to release everything that's in my head that I think is an ongoing journey for me. But I guess we all have to have goals, and I think the fact that I'm there and not in the fighting state but more in the state is a good place to be. So I guess that's the summary of where I'm at and how I've used exercise, and like I said, very happy to answer any questions. And thank you so much, Dale.
Oh, thank you, Nicole. Great. And I think, that was one thing I wanted to really point out today. The psychosocial benefits of exercise as well. I mean, we go on a lot about the physical benefits of exercise, but there's so many psychosocial benefits, and that's why we really try and promote our groups that we have here as well, because the people that participate in those groups absolutely love it for the psychological benefit. Yeah. So, which is great. But thank you so much, Nicole, for talking.
No problem.
Any questions for Nicole? Or?
I have a question.
Oh, yes, good.
Nicole, how did you set your goal for the next week? I think it might be relevant for some of our listeners here tonight about sort of, how did you internalise your own goal setting week to week?
So I think that was a very difficult thing for me to do at times, particularly after coming out of surgery. So when I was in the throes of a chemo regime and I knew what was going to happen, I would go see my exercise physiologist and sort of have a conversation about what I wanted to do. And very often I would set a goal for myself, like I want to be able to learn how to do pull-ups, for example, like just a random, okay, so we're going to have to work on your core strength, and we're going to have to, so I would just sort of shoot for something random because that felt achievement oriented and I could go after it. But then after I'd have a surgery, so I've had 2 liver resections, a bowel resection, 6 lung resections, 2 other thoracic surgeries, and a piece of rib removed as well. So coming out of a surgery like that to then have to start again, and whether it was starting again to try to get my cardiovascular system back or starting again to get my core strength back, or that I found very difficult. But I think that it's in those situations where you're working with an EP who can sort of say, well, why don't we set this challenge? Or, and they understand your psychological outlook as well as your physical ability. I think that's what's made a big difference for me, because someone can actually, it's almost like a therapy in a way for your mind as well as your body, to sort of say, well, how do we set that goal and go after it? So,
thank you.
With help is the short answer.
Can I just ask, how did you find the exercise with your pain management, having gone through so many surgeries?
Yeah.
It might be helpful for...
Yeah, I found, to be honest, my body is in the least amount of pain when I'm exercising. So I find that I'm much more easily able to transition off all of the pain medication if I get moving. And of course, when you're coming out of surgery, that starts with just doing laps around the ward. But after a simple thoracic surgery, if I had just had keyhole, like I would be doing, like the day after my operations, I'm doing sneaky squats in the room, generally when the nurses aren't around, because they come in going, oh, high maintenance patient, falls risk. I don't want to advocate for being too crazy. But yeah, I really found that the more I did that, and a lot of like my surgeries have generated not your typical kind of pain, right? You get all these kind of weird kind of nerve impacts, and so I've got those sorts of things to deal with, and I've had, because like the thoracic surgeries kind of kill a lot of the nerves, so I've got bits of my muscle that have kind of collapsed and aren't there yet, and so to recruit those muscles is quite difficult at times. So yeah, I have definitely found that I'm in less pain as a result of exercising, but I have also needed to rely on input from a professional who understands the way the body works to say, how far can I push this? Because exercise, of course, does hurt at times. Let's acknowledge that. Sometimes it can. So at what point is this a safe hurt? And where am I transitioning into something I don't really want to do? So, yeah.
Your attitude and the way you speak about it, Nicole, is so beautiful. You just sound so positive despite everything you've gone through.
Yeah,
so I think it's really,
I guess
really
it just
good.
becomes part of life, right? Like it just becomes part of your experience, and to be honest, it is so nice to just be able to have a conversation like this with an audience who just go, yep, get it, and I'm seeing lots of nods because, and I'm sure people in this room can really relate to the fact that this kind of experience can be incredibly alienating, because when you walk into a room like this, generally it's not people who actually share an understanding of what a cancer diagnosis and treatment period is, you know, and so you're sort of sitting talking to people at a drinks night and they say, well, what do you do? Well, I don't do a lot at the moment and this is why. Okay, I'll find someone else to talk to. This is a real downer. So, you know, it's really nice to be able to talk about it and share it, and yeah, I'm getting better at normalizing it and just talking about it as part of normal life. Because I mean, ultimately, by the time they're 85, 1 in 2 Australians will have dealt with cancer and a diagnosis. So I think the more that we can just understand it as something that is just part of life and just needs to be spoken about, the better for all of us.
Great. Well, thank you.
Thank you.